Good morning. RIO and Dianova share a long-standing commitment to recovery, social inclusion, and human rights-based treatment. From your perspective, what concrete added value does this partnership bring to the global drug policy arena? And how does it strengthen the credibility of civil society as an implementation partner for member states after CND 69?
Well, for us, an important point is international cooperation. You know, the field doesn't develop nationally, it also develops internationally. And values like human rights, recovery, it's universal values. So we can actually learn a lot from each other. And another point is perspective. With a partnership like RIO and Dianova have, we can see our work through an international lens or eyes, which can really help us improve our work and share experiences. And also, I think one positive out of these our partnerships is that we can speak with a stronger shared voice. You know, organizations with shared values. I think if we come together, it gives us legitimacy, and it shows that our values, our perspectives come from lived experience across countries. Yeah.
CND 69, once again, highlighted the move from declarations to delivery. In that context, how do you access the current balance between control, public health, prevention, treatment, and human rights? And where do you see the strongest momentum for a truly people-centered drug policy?
I think there's still a big imbalance and a lot more focus on security and control rather than supporting people and treatment, harm reduction, all these things. And even in Norway, which is considered quite progressive, you can still criminalize and use coercive control against people who use drugs. So some places it's actually kind of going in the wrong direction at this time. But we do see a lot of positive development as well. Like some places in Europe have a more health-based approach to drug policies, focusing on values like treatment, recovery, harm reduction, all these things. And even in other regions, there are, like Latin America and Africa, there are discussions about different approaches to drug policy. But I think the biggest momentum is in civil society itself, because people who use drugs or have lived experience are increasingly a part of the discussion, and their perspectives are really important to find what really works and have like real person-oriented policies.
If CND 69 was about scaling what works, what are your three takeaways for the next months in terms of influencing national policies, expanding access to quality treatment and recovery support, and ensuring that the voices of people with lived experience shape the implementation phase?
We will try keep trying to influence national policy makers. We represent people with lived experience, and their perspectives are really crucial when we make policies and put policy into practice.